So today we're doing the rowing machine, which definitely involves the back. It's really helped to strengthen my back. Again, before my surgery, it was painful. I could do it, but it was painful. Now I have absolutely no pain while doing the rowing machine. So if you like to be active and you want to continue to do things like this and you're having back pain, I highly recommend getting some help. My name is Andrea, and I started having back problems 30 years ago. I started having back problems. It was enough that I went to a doctor probably when I was in my 30s, maybe in my 20s, and I had some injections. It didn't really help. They tried therapy. That didn't help. I started my own exercise routine. I then started having more problems. I started going to a chiropractor. That helped a little bit. I was not getting better. I was now in my 40s. Things were keeping me from doing my exercise. The pain was chronic. I had the pain every single day in my low back. I then heard about Dr. Deuk's office and his surgery center. So Dr. Deuk, we started off, I had an MRI that had been done in a previous place, and he did x-rays and he reviewed my MRI, and based on the results of my MRI, we did some steroid injections in my back, hoping that that would, relieve my pain level and that I could delay having surgery. I went for approximately a year and we did multiple steroid injections, and they would last maybe a week on my back. It wasn't really helping any at all. I had a series of maybe 4, I want to say 3 or 4 injections in a year. And after that wasn't working, we did another MRI, and things had deteriorated even more. And I also did a nerve conduction study, which showed the damage in my nerves. And at that point, I had to make a decision to do something to fix the problem before it deteriorated any further. We decided to do a 3-level fusion. I had my surgery 6 months ago. I went into surgery at 2 p.m. We were done at, I believe it was around 6 p.m., 6:30, or at least that's when I woke up. And I was feeling great. I had a walker. Within an hour of waking up, they had me out of the bed. I walked, just a little bit. I was doing fine. All of my vitals were good. By 9 o'clock, my friend drove me home. The nurse that was going to be taking care of me, he was actually there. He followed us to my house. And we got home and we got all settled in my own personal bed, which was wonderful. I had IVs, they had leg compressions on me. Everything you have in the hospital was done right in my bedroom. It was wonderful. I mean, it was absolutely wonderful. I got up the next morning. The nurse stayed with me through the day. I was up, I was outside, I was walking my dog. Within 2 weeks, I was out, I was shopping. I went out and did Christmas shopping. Started back, I do a lot of exercise. I started back to CrossFit, which is metabolic training. I went 4 weeks after my surgery. I did wear the brace. It's now been 6 months since my surgery, and I've progressed throughout the 6 months amazingly well. On a scale of 1 to 10, I would say my pain is down to a 1 or lower right now. And it was at a constant, probably a number 7, but mine was a constant pain. It didn't come and go. I was not able to run anymore. I'm now able to run. I'm able to do jump rope. I'm able to do jumping jacks. I was not able to do anything that had any pressure point. So it's been an amazing experience for me, and for anyone that is having chronic back pain, I highly recommend Dr. Deuk's office. If it wasn't for Dr. Deuk, I would still be living in pain.